Hello everybody, I'm Ahmed Sarwar. I'm a third year medical student in the University of Suleimania of Kurdistan, which you probably has never heard of, so let's try and change that. So basically in this short video, we're going to be talking about hypothyroidism, what is hypothyroidism, what are its common signs and symptoms, and basically what is its treatment and stuff like that. So let's start with hypothyroidism. Hypothyroidism is the name I mean. Hypo means decrease. Thyroidism is related to thyroid gland. So basically we have a decrease in the thyroid hormones. But we mean by thyroid hormone, we mean by T3 and T4. We do not mean by calcitonin, which is also produced by thyroid, not by thyroid. So anyway, we have a decrease in the level of T3, we have a decrease in the level of T4, but we have an increase in the level of TSH. This is the body's compensatory mechanism. This is the body's attempt in order to save us, because when we are getting a disease, the body ain't gonna be just sitting like this, say, okay, let the person die. No, the body gonna try to fight back. So that's why when T3 and T4 are decreasing in hypothyroidism, the body tries to increase the level of TSH as much as it can, so that as the last hope that it can stimulate thyroid gland to produce T3 and T4 and basically to normalize the deficiency. But obviously the body is failing. That's why we are having this video, and that's why we need medications. So this is about the lab result in case it came as an MCQ question or something like that. Now let's come to signs and symptoms. So what are the signs and symptoms of hypothyroidism? For this, you need to understand the basic function of T3 and T4. So basically T3 and T4 in the heart are, for example, leading to stimulation of heart rate, leading to increased heart rate, leading to increased contractility. So when you have deficiency of them, there is going to be bradycardia, obviously. For example, in the metabolism, T3 and T4 are increasing BMR. So when you have deficiency, you're going to have decreased BMR. If you have decreased BMR, the patient is going to be overweight, obviously. Another thing, T3 and T4 are, for example, producing heat. They are leading to thermogenesis. They are maintaining body's temperature. When you have T3 and T4 as deficiency, then there is going to be decreased heat production. The person going to be cold intolerant. The person is always shivering. The person cannot stand cool weathers. And the person going to have a dry scaly skin, because basically T3 and T4 are also producing sweat. So the person going to have no sweat. The person going to have dry scaly skin. That's very important. Another thing to keep in mind is basically the mood of the person. T3 and T4 are maintaining mood. Their decrease going to lead to decreased mood. The person going to be having depression. The person going to be always fatigued and stuff like that. So those are some of the most common basically signs and symptoms of hypothyroidism. So what is the treatment? Basically, we have decrease in T3 and T4. So treatment involves replacement of T3 and T4. That's why we have liothyronine and levothyroxine. There is an E in here. I'm sorry, I forgot to write. So basically, hormonal therapy is the treatment is hormonal therapy of replacement of T3 and T4 by synthetic T4, which is levothyroxine, and by synthetic T3, which is liothyronine. About medications, there are a couple of things that you need to know. First of all, keep it in mind, since in the human body normally, we are producing T3 and T4, but T4 can be converted to T3 inside the peripheral tissue. So if we use levothyroxine, we're going to be replacing both T3 and T4. Directly T4, and via conversion, we are also replacing T3. But if you are using liothyronine, we are only replacing T3. But as we all know, the active form of thyroid hormones is T3. So liothyronine, is more potent because it is immediately giving us the active form. That's why it is usually used in severe hypothyroidism, in more problematic conditions, or when we have a defect in the conversion of T4 into T3. It's used in situation in which T4 cannot be converted to T3. So what do? You give obviously synthetic T3. That's another thing. Another thing to keep in mind is their duration of action. Basically, levothyroxine also have longer name, I think. Basically, levothyroxine, it also have longer name. It is basically longer duration of action. But liothyronine, it has shorter name and it is shorter duration of action. Or basically, T3 is less than 4. So this one is shorter duration, this one is longer duration. That's one thing. Another thing to keep in mind is whether they are slow acting or rapid acting. Levothyroxine, it is T4. It should be converted to T3, then it can work. So it is obviously slow acting. This one is immediately T3. You give it, it works. So this one is longer. This one is rapid acting. Another thing is potency. Basically, this one is T3. It's immediately the active form, so it's obviously more potent than this one. It is going to be less potent because it is inactive form and it will be converted to T3 and stuff like that. That's also should keep it in mind. So once again, levothyroxine is long duration of action. It is slow acting. It is less potent. This liothyronine is short duration of action. It is more potent and it is rapid acting. And keep it in mind that the first line of therapy is levothyroxine, just because of all that I said, because you do not want to give something that is very potent, that will immediately overcorrect it to severe hyperthyroidism. And we need something that is more long duration so that the person can have better compliance, the person can be using a single dose of the medication and stuff like that in compared to levothyroxine. But levothyroxine is used in severe cases. It is sometimes even used in combination of levothyroxine, and as a last result, it can be used as a maybe even monotherapy. That's also about that. Another thing to basically keep in mind is that the medication of hypothyroidism, which should have been the first thing I said, but I'm sorry about that. But the most important part is this medication is individualized to the patient. It is not same for everybody. It must be individualized for the need of the patient. We're gonna basically start at a low dose usually and find out what is working for the patient based on the patient's clinical response and based on the lab result, T3, T4, and TSH normalization. And this is a lifelong medication. It is not going to be used for a while and then the person going to be cured and stuff like that. No, this is a lifelong medication. The person has to take this drug for like forever, just like kind of like type 1 diabetes, for example. There is like nothing you can do. The hypothyroid gland is not working properly. You have to give medication lifelong till the person is dying. And then their basically time of action. Like I said, levothyroxine, it is their dosage form. Sorry, it is given as a single dose because this is long acting. It's usually given in the morning before meal on an empty stomach. But levothyroxine is short acting, therefore it should be dosed multiple times throughout the day in order for the person to benefit from it. Now let's come to side effects of this drug. The most common side effects of these drugs are overcorrection. They are used as hormonal replacement in deficiency of T3-antiphon. They are overcorrecting them, leading to increased T3-antiphon. They are leading to hyperthyroidism. They are changing bradycardia to tachycardia, cold intolerance to heat intolerance, no sweat to massive sweating, and stuff like that. Basically, depression to anxiety. These are their side effects. So what we will do to the medication of the patient in this condition? For example, in pregnancy. In pregnancy, thyroid hormone requirement will obviously increase. That's why we are increasing the dose of levothyroxine, or if the person was on levothyroxine or combination therapy. Basically, we are increasing dose, but you're going to be closely monitoring the pregnant mother to do adjustment based on the lab result, based on the clinical response. But in old age, the person is in elderly, the person is already basically it's at risk of cardiovascular arrhythmia and stuff like that. So we do not want to risk massive change of bradycardia to tachycardia. That's why in old age, we are starting at a low dose, then very gradually increasing till we are reaching the sweet spot. Sorry. So what about myxedema coma? What's myxedema coma? Myxedema coma is the most severe form of hypothyroidism. We have almost no T3, almost no T4. The person gonna be extremely fatigued, dizziness, bradycardia to the extreme, basically cold intolerance and all that. So it is an emergency. So what do we give? We give IV treatment of levothyroxine and levothyroxine based on the situation. Usually, obviously, levothyroxine can be maybe considered to be a better choice, but both of them can be given. But the point is, we are giving it by IV because it's an emergency. Besides this condition, we are giving the basically medication as oral route, as a tablet or as a capsule and stuff like that. There is no need to do IV for it. But in myxedema coma, we need IV. So basically, that's everything about hypothyroidism, from basically lab result to sign and symptoms to medication and all that. So thank you very much for watching the video. Tell us in the comment section what do you want us to talk about in the future videos. And basically any opinion, suggestion, you'll be very glad to hear about them. We are very new to this and really want to improve. So thank you once again. Have a great time and keep studying, guys. Goodbye.